and I'm going to talk to you today about anesthesiology. So, first question is, what is your specialty and what are the most challenging and rewarding aspects of your field? So, just a little bit about me before I get into that, and that's that I completed my anesthesiology residency at Mount Sinai West in St. Luke's in New York City, and I'm currently doing a one-year regional anesthesiology fellowship at Columbia New York Presbyterian. So, fresh out of residency. So one of the challenges of being an anesthesiologist is that you need to know a lot about everything. And what I mean by that is that as anesthesiologists, you're involved in many aspects of the hospital and you see a diverse group of patients. You see everything from pediatric, cardiac, neuro, ENT, orthopedic, and trauma patients on a daily basis. In the operating room, you are the one doing invasive procedures like intubation, IVs, arterial lines, central lines, and nerve blocks. You are also the one placing epidurals on the labor and delivery floor and managing the anesthetic for C-sections. Anesthesiologists are also attendings in medical, surgical, and cardiac ICUs. And in addition to that, when you're on the anesthesia team, you also go to medical codes and are involved in emergency airways within the hospital. So while you have to be well versed in different areas, having a large fund of knowledge in many aspects of medicine, I think, is rewarding in itself. Okay, number 2. What is a typical day and week at work? So the day actually starts, I would say, the night before. So that's when you look up your patients assigned to your operating room for the next day, and you come up with an anesthetic plan for each patient. You review the patient's charts, including their medical history and any medical clearance. If the patient is already in the hospital, you would potentially go see them in person. In residency, you also call your attending night before to discuss the case for the next day and your plan. So on the day of, I would typically arrive to the hospital around 6:30 a.m. and that's to set up the operating room, sometimes earlier for more complex cases. I would then go see the patient in the preoperative holding area around 7 a.m. and that's when you discuss your plan with the patient, place an IV, obtain consent. Once everything is squared away with you and the surgical team and everybody's on the same page, you would then kind of head to the operating room around 7:30 a.m. and that's a pretty standard start time. So once you go through the case and everything's complete, you bring the patient to the recovery room and then you kind of start the process all over again for the next case in your room. So in residency, this typically goes anywhere from 4 to 8 p.m. depending on your program, at which point either the cases are done in your room, the resident call team is there to relieve you, or a nurse anesthetist comes and relieves you, or the day can just continue for you. So a lot of variation. So during residency, it's common to take one weekday call a week where you stay overnight. And then on average, I would also have about 2 24-hour calls on weekends. So a Friday, Saturday, or Sunday within the month. So another way to look at it is that I would have roughly 2 full weekends off each month. So question 3, what are 3 adjectives to describe the typical anesthesiology field? So first I would say it's gratifying. I think patients are very thankful for keeping them safe during surgery. 2, I would say it's challenging. So while some days are easy, some patients have complex medical problems which require a lot more thought and preparation. And 3rd, I would say it's hands-on when you get to do a lot of procedures and you're directly interacting with the patient.